Hello, welcome to Riversoft University. My name is Shelley Wolf, and today I will be going over Start of Care Part 5, 485, Diagnoses, Medications. You will notice on our Start of Care note that the 485 tab remains yellow. This means that it is requiring additional information. We will click on the tab and up will come the 485 editor. Here is where we will add our first diagnosis. We will be clicking on the button to the left of Locator 11 to add our first diagnosis. From here, I will be clicking on the New button, and there is multiple ways to pick a diagnosis. I will show you all three ways. The first way is once you hit the New button, you can click on the ICD-10 tree and pull your diagnosis code directly from the tree. It will automatically place in your description. You will add your diagnosis date, your diagnosis status, and your severity rating, and save. An additional way to add your diagnosis is to click the New button, key in the code, hit the Description button. It will populate the description for you. You will add your diagnosis date, your diagnosis status, and your severity rating, and save. The last way to add a diagnosis is if you are a clinician in the field that is not familiar with ICD-10 codes. You can go into the description area and add a description. By doing that, you will continue to fill out the required areas and save. And as you see on the editor screen, it puts in the description with no diagnosis code. This will be reflected on the review screen for your clinical manager and coders to code this diagnosis properly. However, still allowing the clinician to complete the note. To add a medication, we're going to click on the Edit button to the left of Locator 10. Here is where you will pick medications from our Lexicom database. If you use our Lexicom database, it will check for a drug-to-drug interaction check, whether or not the medication appears on the Beers list, whether or not the medication is high risk. So we're going to look for a medication right out of the Lexicom database. This is a service that is provided to you and all Riversoft customers. We're going to add our status and our regimen. And our start date. If you wish to add another medication, you will find your medication in the list. Add your regimen. and your start date. And save. Now you can see on our list of medications that the Vicodin appears under the high risk column and the Beers column. If I want to check to see if there's any drug-to-drug interactions between these two medications, I will simply click on the drug-to-drug interaction button, and that will run a scan. And in this case, we don't have any interactions. We provide you with the Beers list, which is all the medications that are potentially inappropriate for our older population. If you click on a particular medication, we provide you with an English and a Spanish med teaching sheet that the clinician can use or can be provided to the patient. We also provide you with a medication profile and a medication history. So if you have a client that is changing medications throughout the episode from one dose to another and so on, you will be able to track when the medication changed, when it was added, when it was discontinued from your medication history. There is an I button that will explain the screen in greater detail, so I highly recommend that you review that. If you add a medication in error, you simply click on the medication and hit the delete button, and it will ask you if you are sure you would like to delete this medication, and you can say okay, and it will remove that medication. So that is how you add a medication and how you add diagnoses to the 485 editor. Thank you. Bye-bye.